Describing the anatomical properties of brushing one's teeth.
Brushing teeth is important for removing plaque buildup, promoting oral hygiene, and prevent gum disease and tooth decay.
When she's brushing her teeth, she's using her shoulder joint, which involves the glenohumeral joint and the acromioclavicular joint. She uses her elbow joint, which is the humeral joint, the humeroradial joint, and the proximal radio-ulnar joint. And then she also uses her wrist joint, which is her carpometacarpal joint, midcarpal joint, and radiocarpal joint.
Because her arm is moving freely, it's going to be an open kinetic chain movement. The action uses linear motion and angular motion for a combination of general motion.
The shoulder is a ball and socket joint, and it moves in all three planes: sagittal plane, frontal plane, and transverse plane.
So in this movement, the shoulder joint is going to extend, flex, and then it also abducts. To bring the toothbrush to her arm, she's going to flex her elbow joint and extend her elbow joint to do that. So flexion and extension are happening in the sagittal plane, and then also the elbow is going to allow for her forearm to pronate and supinate to move the toothbrush, and then that happens in the transverse plane. Her wrist is also going to flex and extend, and that's going to happen in the sagittal plane, and then it's also going to allow for ulnar and radial deviation, which happens in the frontal plane.
Other important structures to know in this movement in the shoulder is we have the subacromial bursa, the coracohumeral ligament, and the glenoid fossa. In the elbow, we also have the orecranon bursa, the medial collateral ligament, and the lateral collateral ligament. In the wrist, we also have the radial bursa, the ulna bursa, and we have the radial collateral ligament and the ulnar collateral ligament.